It's time for the 1430 Connection on 1430 WNAV and 99.9 FM, spotlighting news, newsmakers, and important community issues. Now, with this week's edition of the 1430 Connection, here is WNAV news anchor Donna Cole.
Welcome to the 1430 Connection. I'm Donna Cole. In the studio with me today is Jen Corbin. She's the Crisis Response Director for the Anne Arundel County Mental Health Agency. Jen, thank you for joining me today.
Thanks for having me.
You don't have a moment of downtime on your job?
No, over the last couple of years, we've definitely seen an increased volume, partly because we're taking on whatever the county needs us to. And what's one of the really great things about our crisis system versus other counties is that we kind of change as the county sees the need. You know, we started with mental health, kind of grew into some working with Department of Social Services on homeless issues. And when the insurance changes happened, we kind of helped with that. And now we're kind of looking at the heroin opioid epidemic and kind of doing some substance use with the police and fire. So we do whatever's needed in the county to offer a resource because we are 24 hours a day.
And we'll get into the heroin and opioid epidemic, but we're going to start with jumping back on the 1430 Connection. At the beginning of the year, I did a series on suicide awareness with two of the programs focused entirely on adolescents, particularly those in Severna Park. And at that time, mental health agencies, the county, visiting sociologists from the University of Chicago, representatives from various community organizations, including one church, vowed to continue the dialogue on a very serious issue of increased suicide rates and suicide clusters, which Severna Park does have. Other areas of the county do too, but that was the focus on the series. Where are we at with that, the dialogue in Severna Park and helping to address?
So the dialogue, and we'll talk about Severna Park, but I'd like to talk about, we focus on several areas where we're seeing a higher rate of depression, anxiety, pressures of young people. And where we are is opening the dialogue more and more. Over the last year, myself and Lieutenant Thomas have worked directly with the school system.
Lieutenant Thomas?
Of Anne Arundel County Police Department, who is head of our crisis intervention teams with crisis response.
Okay.
So that's where we have our officer paired with a clinician. We have kind of worked directly with the Board of Ed and the local principals and have really gotten all of the principals trained in mental health first aid youth. We're trying to get out there and identify signs and symptoms of early, because there's a 90% success rate if individuals are identified early in their youth with some kind of signs and symptoms of depression or anxiety. This past
90% success rate
in getting them help and staying well.
Okay.
So one of the things we did, which we just completed in August, was, if you're talking about Severna Park area, Severna Park Middle School now has 98% of their entire staff trained in mental health first aid.
Well,
teachers,
awesome.
counselors, administrators, everybody. And so that's a start.
That's fantastic. That's good to hear. When I did this series, I reached out multiple times to the county schools and never heard back, and I was concerned by that, and I kept pressing, and I never heard anything. So this is good to hear.
Yeah, we're having a great communication with them, and part of that's coming from the Board of Ed and the fact that the cluster heads have been working with us. What I mean by that is the schools are in clusters, and we've been working with each representative there to reach out to the principals of those schools, and now we're really down to even like the vice principals, which is really great. And so I think that education is the start, getting people working towards prevention, getting people linked to resources earlier.
Okay, so that's happening in schools. What's going on for parents?
So for parents, I've done a couple of series out in the community called Not My Child.
Right.
With the heroin epidemic, but I also do something called You're Not Alone, which is really talking more about the mental health piece. And I know you've had Sherry and Larry Lincoln here from Ellie's Bus. I work kind of in partnership with them. We kind of go around doing these series and talking to people as much as possible. Sherry and Larry with Ellie's Bus also do concerts during the summer. So we've been out giving literature out, really trying to get the information out to tell families and kids, you know, here's a number you can call if you need it. When I'm doing the Not My Child in the schools for the heroin epidemic, I make sure to spend 10 minutes with the kids talking about mental health. It's amazing what I hear from the kids about feeling anxious, feeling the need to be perfect. When you ask them questions, how many hands go up saying, you know, yeah, I'm stressed. And so we talk a lot about handling that. And I ask them all to put the number in their for crisis response in their phone, because they might not need it just for themselves. We have to remember that another way to kind of work this issue out is peers to peer, a peer who knows someone is struggling or might be posting on social media that they thinking of hurting themselves can reach out. And we've had great success with that.
And that's so important because parents, as much as we do try to keep an eye on our kids as they get older, it's harder and harder on some of these social media platforms. And that's huge that the kids do see things that we don't see.
Yeah, so we talk to the kids about one of the big coping things we tell them is, I want everyone to think of 3 people that they could go to with the best news in the world. Then I say, those are the same 3 people you can go to when you're not having a good day. And what I jokingly tell kids, I know you're going to want to pick 3 peers. I'm okay with you picking 2, but one of them should be an adult. And it doesn't have to be a parent. We got to remember that we're all in this together. And sometimes, a coach, a teacher, a youth group leader might be that person that your child goes to. Doesn't matter as long as they're talking to somebody and getting the help they need. And so we talk about the 2 peers being making sure they have access. And since doing that, we've actually had 2 calls into the Warm Line this past year where peers reached out to their parent and said, my friend's in trouble.
That's awesome.
And that was through social media posts.
But not awesome that it has to be done,
no,
but
we
awesome
saved
they're doing
them.
it. Yeah.
We help people that could have gone down a really dark road.
That Warm Line is 410-768-5522.
Yes.
There is a buzzword I keep hearing called resiliency, and we talked about it briefly when you walked in. You had a program yesterday on
last week.
Last week. My question is, are we focusing too much of our efforts on teaching kids to be resilient and not enough time teaching people, including adults, how to be kind, considerate, and empathetic? And you might not have the answer.
50-50. I don't have the answer. I'd be 50-50. I think resiliency is so important. That's why you see me. I kind of light up and smile about that. The more we can get that word out, because what we did in this workshop, there was an evening program for parents, and I believe there were about 150 people who attended, if I heard correctly. Teaching parents to understand resiliency is important. It's the way you talk to your child, it's the way you present something, the way we teach them to be resilient. I'm not talking about everybody gets a trophy and an award. I'm talking about resilience like, hey, you're going to have a day that's really bad. How do you bounce back the next day?
All right, hold that thought, because we have to take a break, and I want to know.
Thank you.
This is Donna Cole on the 1430 Connection. We will be right back. Welcome back to the 1430 Connection. I'm Donna Cole. In the studio with me is Jen Corbin. She's Crisis Response Director for the Anne Arundel County Mental Health Agency. The question was this buzzword that I keep hearing about called resiliency, and focusing a lot of our efforts on teaching kids to be resilient. How do you do that?
So it's talking about, it's not pampering them, it's not giving them what they want. I think there's a mistake here. Resiliency is when you have that tough issue or that tough day, how do you bounce back the next day? How do you work to make sure those coping skills are in place? I know there's the argument that we need to be more empathetic, yes, but we also need to teach them that there are going to be days, whether you're young or old, that you're going to have a tough day. You still have to get up and go to work the next day, to school the next day. How do you conquer that? How do you become resilient to know that today might be terrible, tomorrow might be okay? That's the part that's missing in youth right now. When we talk to kids, they can't see past today. People, when they talk to me, I say this repetitively. You ask your kid how you're doing today. You don't ask them once, you ask them several times, because throughout the day that changes for them. The issue, though, is the next day, are you having that conversation to say, hey, is today better? How did you get past it? Talking about those coping skills. They are going to learn from those interactions. Again, having conversations. This is not an email or text. This is sitting down with your kid and having a conversation. Now, on the other side of things, you're asking me about parents. And
and this does go to our society right now and social media. And every time I do one of these shows, all my friends say, can you please get more information on how to handle social media? We as adults are having a tough time being or seeing that people are being kind, considerate, and empathetic to one another on social media. We are seeing it in person, even outside of social media, when we don't have the same football team, when we don't have the same candidate, when we don't like the same things. We're getting to a point where we can't discuss it with civility. We're attacking one another. This has got to be seen by the kids.
Absolutely. And I think that kids are also finding it as a way to kind of figure out where they stand in society themselves. We jokingly talk about, when I talk to kids, I'll say, how many people post something and then sit there literally watching your phone to see how many likes you get? There's an endorphin run that happens from waiting to see how many people like something that you post. Or it makes you either validate your feelings. So we talk a lot about that, but we're getting away from kids being able to come to someone and say, I need help. And that's one of the things I'm learning a lot from the kids. They post it. And then if someone offers help, that validates whether they're important or not. If nobody reaches out, what happens?
Is that okay for kids to post about their mental health?
I think I'm half and half on that. If they feel like they have nobody to talk to and someone can get them help, yes. But I think we really need to be teaching kids to go to adults. There needs to be that communication again. And I think they're learning from parents. You know, I mean, we fault kids for always being on their phones, but if you look around, a lot of times parents are on their phones too, or posting just as much on Facebook or on the other apps as well. So I think, you know, it's just like I use when I'm talking about drugs and alcohol. You know, if we go to dinner and or we come home from work and say, I've had a bad day, I'm gonna have a glass of wine, and then you're telling your kid that makes you feel better. If you're posting something to see how many likes you have, you're setting that example for your child. So I'm really trying to encourage parents when they come home from work to sit down and actually have the conversation with their kids, put the phones away for half an hour and sit down and have that face-to-face. Everybody unplug. That's really important.
And this is equally important for a 7-year-old as it is who shouldn't be on social media yet, as it is for a 16-year-old who sometimes it's really difficult to pull their phone away.
Yeah.
It might be even more important.
And part of it, you know, the conversation and the argument that we have a lot of times is social media is so important in the schools because everything now is computerized, and, you know, just everybody taking a break from it and sitting down and having that conversation. And it's funny because a lot of parents will say, well, what happens when your kids just say, fine, good? Then you keep asking questions and you reword it so that you can start to teach your kids to have that dialogue.
It's a
so important.
skill we get as interviewers. Don't accept
Yes.
the one word. Yeah, delve deeper. All right, we're going to take another short break. When we come back, we're going to go into the heroin and opioid epidemic. This is Donna Cole on the 1430 Connection. We will be right back. Welcome back to the 1430 Connection. I'm Donna Cole. I'm in the studio with Jen Corbin. She's the Crisis Response Director for the Anne Arundel County Mental Health Agency. We are in the midst of a heroin and opioid epidemic nationwide, and in this county, we are no different. You have done something that's kind of pretty awesome. And this started, we were talking, with a police chief in Gloucester, Massachusetts.
So basically it stems from the PARI program in Gloucester, Mass, where a police department decided to open up their doors for people who are seeking recovery in which they will help. And since then they've had great success.
So the police, instead of arresting, instead of searching, will just say, let's get you some help.
Let's get you some help. Yeah. And so we kind of took that along with an angel project model through FIRE, and we kind of merged them together. And really, it was just a collaborative effort
to create the safe stations
to create
program.
safe stations, which I think the whole county is really proud of, and they should be. The recognition of the fact that so many agencies are working together, I've just never seen anything like it. PARI actually came here to visit us. We were presenting somewhere, and they were just saying, you've taken it and exploded the idea into something. I mean, there's nowhere else where you have a state's attorney's office and support, FIRE, police, health department, and crisis all working collaboratively together.
And again, the way this works is anyone with a problem with heroin or opioids, any sort of addiction issue, you can go to any fire or police station in Anne Arundel County and ask for help, and help will be given.
Yeah, and I want to say it's 24 hours a day. And I want to clarify, there's been some questions recently, just over the last couple of weeks, about, I know the start was for heroin and opioid addiction, but we see lots of people who have other addiction issues that need help. So don't feel like, well, I'm not doing heroin, that I can't come in. You know, we see people all the time that have just alcohol or cocaine. If you want help and you're struggling to find the resources, just go to a safe station. We'll be happy to help.
I know you didn't have a chance to get the newest numbers, but you said this has helped many.
Yeah. As of the end of August, we had a 60% success rate, and only 10% have relapsed. I can't remember when we were at the end of August, but we are over 240 people at this point, probably more at this point, people coming into the safe station. So seeing that and knowing that that's helping, we're also starting to hear rumors that it is kind of leveling out the overdose rate, because we were on a pretty big trend upward at the beginning of this year, which is actually why we instituted safe stations, something to just try and reduce the number of overdoses and get people help.
That's amazing. It
Yeah.
really is.
Yeah.
I mean, huge round of applause for all of you that are
Thank
making
you.
a difference here. How do we address the severe, and this is not just in Anne Arundel County, not just in Annapolis, it's everywhere, lack of help in the mental health world? Our resources are pretty thin.
Mm-hmm. I wish I knew the answer to that question. I think it really stems from kind of what we're doing now in the county, which is working together. I'm leaving here today and going to a big provider meeting. I don't know anywhere else where providers get in the room regularly right now to try and figure out how can we work together? How can I maybe open up some more spots for mental health? And well, if you do that, then I could see your people for substance use over here, and the blending of resources that are going on. And kudos to the health department. I mean, the health department is the one that's really making this happen, allowing there to be integration, which is really what we need, taking mental health and substance use and really doing what the state is asking, which is behavioral health. Because probably 85 to 90% of the people we're seeing right now are what we call co-occurring. They have a mental health and they're using drugs to kind of mask that piece.
There are people that are triggered by this, accepting that addiction is a mental health thing. Mm-hmm. Address that.
So substance use is a brain disorder. Once your brain is craving that, it's very difficult. And so what I'm finding actually through safe stations, I've learned a lot over the last couple months, is when we get people sober, and I don't like to use the word clean because they were never really dirty, right? Once they got sober, what was interesting is we started to see their mental health. And they started to realize maybe I was self-medicating. And so then we have to go down the mental health path and say, let's see someone to see what we can do about your depression or your anxiety or whatever might have triggered years and years ago you starting to use. That's what we talk to the kids about a lot when we're in the schools now is, why do you need to feel better? The marijuana makes me feel better. Well, why do you feel bad? Those are the questions that we're not asking. And so we're really starting to engage that conversation at the middle school level, myself and Wes Adams from the state's attorney's office.
All right. We don't have a lot of time left, but in the short period of time we do have left, we've seen this week and last week come out a hashtag called MeToo being used on social media. This goes to crisis response, I think, yes?
From what I understand, I don't know a whole lot about it.
Okay, so this is addressing either experiencing sexism or sexual assault. If it has happened to you and you need help,
call. Part of that is reaching out and identifying that something is going on. What I think it's trying to address too is the traumatic piece to that. And so if you have been the victim of something sexualized, rape, domestic violence, whatever,
women or men, and I should
women
say,
or men, yes, absolutely. Reach out if there's something you're in danger now. Reach out to the police department. We will be called. If you just want to talk to someone, the warm line is 24 hours a day.
Again, that number is 410-768-5522. The National Suicide Prevention Hotline number is 1-800-SUICIDE. That's 784-2433. Or 1-800-273-8255. More information about your office is available on the internet where?
At the Anne Arundel County Mental Health Agency website.
All right. What have I missed, Jen, on what's important to relay to our audience?
Yeah, I just want to say, I think these are great topics. I want to make sure we don't forget families. Sometimes, especially in addiction, we're so focused on the person who's addicted that we forget that the family's suffering. And not just that, but in the young people who are suffering with addiction, there are siblings involved. And we really need to make sure that families know that there's help out there, whether it's through groups or families, programs. We need to make sure, I want families to know that you can reach out to figure out what you can do differently or how we can help, but we're there to support families as well.
If you're trying to help somebody else and need help yourself, it's often impossible. So do take that seriously. Absolutely. Jen, thank you so very much for your time today.
Thanks for having me.
This is Donna Cole on the 1430 Connection. We will see you next week.